Welcome to Swift Write, a writing agency that provides top-quality content writing services for students. Today, we will be discussing the topic, analysis of public policy. Over the past 20 years, the occurrence of obesity has increased considerably, as has the number of obese people. In 2016 and 2015, about 40% of American adults were considered obese. The prevalence of obesity has been progressively increasing throughout time. Obesity increased from 38% to 40% among persons aged 20 and above within 8 years from 2008 and 2016, according to the Centers for Disease Control and Prevention. The proportion of people who have extreme obesity has climbed from 6% to 8% within the last decade. The prevalence of obesity and severe obesity among people continued to rise throughout the course of this time, although no substantial overall changes were seen in children and adolescents. According to recent data, the prevalence of obesity in adolescents and children increased by 19% between 2015 and 2016. Obesity has increased in prevalence, which is concerning because it increases the chance of developing a variety of non-communicable diseases such as stroke, hypertension, diabetes, cardiovascular disease, and a variety of malignancies. Despite the different strategies that have been developed, accepted, and implemented to prevent obesity, the rates of obesity have continued to rise in recent years. Multiple stakeholders are working together to determine the best effective strategies for reducing obesity, in particular. At the moment, officials are attempting to determine the most effective combination of policies to combat obesity. Targeting food advertisements, change of daily healthy eating and physical activity program by healthcare professionals, public awareness initiatives, and environmental modifications are some of the policy issues that should be considered. At some point, policymakers will have to decide which measures to obesity will be the most effective. At the moment, public awareness is high. The analytical framework developed by the CDC will be the most suitable in studying obesity policy from a variety of aspects, including economic, historical, legal, ethical, and social perspectives. It consists of 3 stages of policy analysis, which are as follows: policy development, policy analysis, and problem identification. On an individual level, obesity has a variety of social ramifications. Weighty individuals typically face prejudice in a variety of areas of their lives, including work and participation in social events, to name a few examples. The ethical challenges related with obesity prevention strategies are concerned with the ramifications for mental well-being, equality, cultural and social values, informed choice, and physical health. Due to the absence of follow-up on the deployment of public awareness programs, this has occurred as a consequence. Legal obesity has been referred to as a new paradigm in the field of public health legislation. Interest in the application of public awareness policy to combat obesity stems from its successful application in combating other health concerns such as tobacco usage. However, the public policy has not been efficient and competitive, and various civil society organizations, as well as academics, have urged the government to enact a public awareness policy supported by legislative changes, with a particular emphasis on healthy diets. Historically, the problem of obesity was never considered a pressing concern until 2010, when it was designated as a public health emergency due to a rise in obesity-related occurrences. In response to its designation as a public health emergency, a variety of initiatives were devised to prevent further increases in incidences, including raising public awareness. While public awareness was raised as a policy, the number of people who participated in it decreased with time. Notably, authorities charged with the responsibility of implementing public awareness programs remained hesitant, and the number of people suffering from obesity continued to climb. Financial obesity has significant economic consequences for both the economics of a country and the economy of a people. The financial ramifications and control of obesity are numerous, to mention just 2 examples. Obesity, as a medical issue, can reduce an individual's performance, which can lead to financial difficulties. The awareness campaigns policy, which is aimed to raise knowledge on the essence of physical activity and healthy food among other things, has a significant impact on the prevention of obesity and the prevention of overweight. Theoretical underpinnings. The theoretical basis of the awareness campaigns policy is backed by social behavioral theory. According to Wilburn et al. 2005, the idea is founded on the concept that conduct is impacted by witnessing the behavior of other people and by future penalties or rewards. The idea may be employed in the formulation of policy, as this can be used in showing behaviors and also shaping thinking. For instance, in the field of public awareness campaigns, such theory might aid in understanding how to motivate individuals to pursue desirable behavior results, like encouraging their interest in weight loss. Campaigns might contain testimony of persons that have accomplished the activity, such as reducing weight, and can highlight the health advantages in behavioral changes. Stakeholders. There are various stakeholders within the legislative arena when discussing the problem of health policy and obesity. Key stakeholders include healthcare providers, the food sector, the governments, employers, and also the middle class. The government, which is the major provider of Medicare and Medicaid outlays, has a great role in ensuring lower medical spending. Building agreement on the change in policy will need to use Lewin's change model, which comprises 3 phases, including refreezing, unfreezing, and moving. The usage of the change model helps decrease opposition amongst those stakeholders and establish consensus throughout the new policy implementation. In unfreezing, knowledge concerning the advantages of the policy change would require being established among those stakeholders. Thanks for listening. If you need a similar paper done for you, do not hesitate to contact us at swiftwrite.com. We offer 100% plagiarism-free content writing services, with 100% satisfaction guaranteed. Follow and subscribe to our channels us on Instagram at swift.write, Facebook at swiftwrite, LinkedIn at swiftwrite services, and YouTube at swiftwrite.